Welcome to another weekly guideline recap. Here's a quick rundown of the guidelines and consensus statements published last week. Some of the guidelines published last week include a new guideline from the American Urological Association on management of lower urinary tract symptoms attributed to benign prostatic hyperplasia, a new guideline from the Global Initiative for Asthma on global strategy for asthma management and prevention, two new guidelines from the European Stroke Organization, one on blood pressure management in acute ischemic stroke and intracerebral hemorrhage, and the other on stroke-associated pneumonia, a new guideline from the European Society of Minimally Invasive Neurological Therapy, European Stroke Organization, and European Association of Neurosurgical Societies on aneurysmal subarachnoid hemorrhage. There were also consensus statements published, and that includes a new science advisory from the American Heart Association on percutaneous mechanical aspiration in patients with right-sided infective endocarditis. 6 new expert consensus statements from the American Association for Thoracic Surgery, and that included an expert consensus on antithrombotic management of neonates/infants undergoing cardiac interventions, an expert consensus on diagnosis and management of heparin-induced thrombocytopenia in cardiac surgery patients, an expert consensus on management of atrial function mitral regurgitation, an expert consensus on surgical management of primary chest wall malignancies, an expert consensus on donor/recipient size matching in lung transplantation, and an expert consensus on evaluation and management of N2+ non-small cell lung cancer. And there you have it. For more information and for the full guidelines, check it out on guidelinescentral.com. See you next week for another weekly recap.